Hi, welcome back to the My Face, My Body show. This month we've got a really interesting topic around the theme of emotive beauty. Now, very fortunate to be here with Tracy Bell at the Tracy Bell Clinic in Liverpool, and we've got something interesting later on. We've got one of her patients, Alex, who has had a treatment that has really transformed his life. But before we start, we've been quite busy, and we've been out in the streets asking people in Liverpool around this theme of emotive beauty. So let's go and have a look first.
Something that bothers me is I've got facial scars. I was burnt when I was a little girl.
I don't really like my teeth as much as what I could. But I always go on about my teeth a lot, but I don't really like them because they've got little ridges on.
Aesthetically wise, I think my weight bothers me a little bit and my feet, I've got trotters.
Yeah, I'd like to get my teeth whitened if I had lots of money.
I didn't like myself aesthetically, my boobs, because I had them done.
Oh, really?
I had them reduced.
The things that have bothered me is like my height, and I'm a bit small, and probably my weight, just like keeping toned and in shape.
It'd be nice to be able to treat yourself now and then to make yourself feel more confident. It can be seen as being vain, but most people do it for confidence and to feel better in themselves.
No, because if you want to get something done, choose in a way that you're not sort of vain because you don't like the way you are, so you want to change.
When you say vain, I think if you get yourself done everywhere, like your nose, if you get like the stupidest little thing done for any stupid reason, then yeah, I'd say you're vain.
I don't think people are vain if they get surgery, because it's just helping them live the life. If they're insecure about something, it's just making them more confident with themselves.
I think the main barrier is cost.
I think the barriers for coming into a clinic probably be the cost of it, if people had the expense to do it.
They are made out to be very expensive. Like, you only hear about people like in Hollywood and places like that who are getting Botox, and I think it's made out to be quite expensive.
Yeah, I think cost would be quite an issue to walk into a clinic, yes, but apart from that, I don't think there should be any other problems.
Hi Tracy, welcome to the show.
Hi Steve.
Obviously we've seen some interesting comments from people on the street in Liverpool. Now, we've seen that, a lot of people are interested in having aesthetic treatments. I mean, what do you see people coming to see you for? What sort of treatments are they looking at?
Really, it's multifactorial. Everything from tooth whitening, improvement in their smile, body shaping, which is one of the hottest topics I certainly can see rising this season. And everything from really changing, not the way that they always look. I always say we produce physical change, but also feeling good on the inside. And that's often what the biggest byproduct of what we do in here is, the biggest prize for the client.
It's not just about the treatment, though, is it? It's more than that. And I think talking to you earlier, it's more about that giving someone back the confidence or something that they never had.
I always say to people, you know what, they come in and say, Tracy, what would you do? And I say, no, take the mirror, you tell me what you want, what bothers you. And that's one of the biggest things that I hear in this clinic, where they'll look at their face, they'll look at their body, they'll look at their smile, and they say, you know what, Tracy, this bothers me. And that's where we always start. From a client-practitioner relationship, if we can solve that problem, we've got a client for life.
Yeah, I mean, because I suppose it's very important in the consultation process, isn't it, that to determine why someone is actually having a particular treatment.
Yeah.
I mean, they could be there for a completely different thing at all, but you determine that in the consultation, obviously.
Yeah, I think one of the biggest problems that I have, or what I try to teach my team to do, is almost get inside that client's head.
Yeah.
So again, why have they walked in that door? How can we help them achieve what they want to achieve? If we've got that winning formula, again, we've got that client coming back through that door time and time again, but also we've got a happy, confident client. These clients are consumer savvy now. They know what they want when they walk through that door. What they don't know is, one, who they can trust. Two, am I going to get the results that I really see on the internet, reading these magazines? And I think as a practitioner, it's really important that you listen to that. And sometimes, you know, the client might come in wanting one procedure, but it's something else that they need in order to achieve that result.
Yeah, I mean, I think we saw from one of the comments on the streets about, you know, teeth whitening seems to appear on a frequent basis, and I think one person said, but they don't know, they'd love to have it, but they don't know where to go. So I mean, it's
again, when it comes to tooth whitening, I think one of the things is it comes down to cost. And I always say to the client, you know what, when you walk in, we've got an answer for and a cost for most things. It could be from a simple scale and polish, which can start from £32. And yeah, you know what, it can go up to those super duper deep bleachings that are probably going to cost £645.
Yeah.
But again, it's listening to them. And I always say to my team, you know, you ask them what they want to achieve, how much their budget is. And again, I listened to those comments on Liverpool, you know, the streets of Liverpool today, and I was like, you know what, come in.
Yeah.
You know, come in and talk to us, because I believe that education of the consumer is really important, and you would be surprised what you can achieve through different modalities that we have here.
It seems to be that there's these myths in the industry, and one of them was that, and we tested this out on the streets, was about going to a cosmetic clinic can be costly. Going to a cosmetic dentist can be costly.
Yeah.
And you know, we saw that on the street. But as you're saying, is that it doesn't have to be expensive. You go in there, and you can, if someone is interested in maybe doing something, it can be very cost effective. You work on people's budgets, don't you?
Again, we work on people's budgets. We listen to their needs, and again, remember, it's what's in here as well.
Yeah,
it's how we're going to make them feel as they walk back out that door. So again, you know, let's bring it back to tooth whitening, maybe a few lines or wrinkles. You know, if you've got somebody that you can trust, and the whole business is built on trust. If I've got a patient that comes in, that speaks to me, as long as I know that when they leave, one, that they've been given the right information, two, you know what, at some stage they're either going to have that treatment or come back to me, and you know what, they feel better about themselves. I feel good. Yeah,
for sure. Well, just going on to that point, I mean, we've got Alex here, whose his comments earlier on, it's transformed his life. Now, Alex, do you want to tell everyone, you know, what treatment you had done and what?
Yeah, certainly. I mean, before I met Tracy, I was always concerned and paranoid about my teeth, because I used to smoke a lot. I used to smoke between 40 and 60 cigarettes a day, and I don't smoke anymore. But what that caused is it caused, you know, weakness of the front teeth and staining. So what I had done is I had veneers put on the front of my teeth, but not only with the staining and some with the wearing of the teeth, I had a large gap between my teeth, and I would constantly hide my front teeth.
Now, you told me earlier on you could put, one of your party tricks was that you could put a cigarette between your two front teeth. Now,
as soon as I had a glass of wine in my hand and a cigarette, I would put the cigarette between my front teeth.
Brilliant.
And that was kind of a thing to kind of make a joke of my gap between my teeth, which I hated, and I really disliked it, but I found humour in it to hide it, and that was my way of disguising it. But in terms of whenever I would eat or anything like that, I would always hide my mouth because I hated the gap between my teeth.
Yeah.
But when I spoke to Tracy, I mean, I'd spoken to people before, you know, I'd spoken to Tracy, but nobody would actually give me the result that I wanted.
Yeah.
And then when I went to see Tracy, I had temporary teeth put on before I had any treatment done whatsoever. And just the photographs and seeing it myself in the mirror, how it would look without a gap, kind of reassured me to do something about it.
I mean, your teeth look absolutely fantastic, and it's great to hear stories like that, because, you know, everyone does like to hear of these great case studies. I mean, the last myth that I really sort of want to hammer on the head is this myth around people think it's, you know, is it vain to go into a clinic to have these a cosmetic treatment?
Well, you know what? I was once that consumer that tried to walk through the door at the age of 31 after having 5 children, one, to get rid of my lines and wrinkles. How did I feel? Probably to begin with, I felt myself, you know what, a little bit silly, because one, that I didn't know where to go to. You know what, I was 31, I was a baby, but you know what, I looked tired. I always remember my first experience where I went to a clinic and I walked in. There was a guy, a doctor, that was sat at a desk. I asked him to how I could improve my lines and wrinkles. And to be quite honest with you, I felt myself almost a bit embarrassed to ask. I'll tell you that I walked out, the favour that guy did, I walked back out of that doctor's office. I made sure that I would make, when I say make sense, but ensure that I would never make anybody feel the way that I felt when I walked in there. And hence that's where my career started in aesthetic medicine.
Yeah, fantastic.
And I went off and trained. And you know what, I always think that we've got a huge pendulum of change at the moment. You know what, it's good to feel good, to look good. And you know what, sometimes we go through life, it's about finding time for me. You know what?
Absolutely.
Yeah, and that is honestly, Stephen, the biggest asset that we have here. You know what? Even if it's just to come for information, you know, we're a pioneer in education, ethics, evidence-based results. I wouldn't provide any client, or nor would my team, of anything that they wouldn't have, or they would basically give to any of their, you know, loved ones, really. And I think now that we have, you know, I can only relate to how I felt. I never want that to happen to anybody else. I think that, you know what, this is 21st century. I should say this, but hardcore beauty. You know what, people expect more. We're living longer. It's good to look good. It's good to feel good. And I think that's what the Tracy Bell clinics do.
Yeah, I totally agree. Well, on that note, I'd like to, you know, thank very much, you know, for us using your clinic. I think it's great, and I think we've all learnt a lot. And I mean, it is true. I mean, I think people get a lot more out of going to a clinic. You know, with as Tracy has mentioned, you know, they come out with a lot of confidence, and a lot of people, I suppose, live their lives dealing with, you know, whether they've got crooked teeth or whether they've got they're slightly overweight, but you know. I would encourage people, and I think, you know, coming to clinics like Tracy Bell, and you can obviously see Tracy Bell on our website on MyFaceMyBody.com and all her educational videos, and you can book a consultation with her if you're interested. But on that note, I think we'll finish up there. We've got an exciting theme for you next month. I won't tell you anything about it at the moment, but we'll see you next month on the My Face My Body show. To find out more information about the topic of the show, search our My Education section. To have your say about future topics on the My Face My Body show, or if you have any questions from one of the shows, write your comments on our Facebook and Twitter pages or through our blog on myfacemybody.com.